Hello, good morning. I've decided to focus on the hypoglossal cranial nerve 12. It is a motor nerve that sends signals to and from the brain to control the motor muscles of the mouth. It innervates both intrinsic and extrinsic muscles, intrinsic being within the tongue, which includes the longitudinal, transverse, and vertical. The longitudinal being two parts to it, the superior, which elevates the tongue, and right below it is the inferior longitudinal, which lowers the tongue, brings the tongue down. Transverse narrows the tongue, and then vertical flattens it. For extrinsic muscles, that means there's an origin point outside of the tongue, and that includes the genioglossus, the hyoglossus, and the styloglossus. The genioglossus being the largest of the muscles, and it allows us to bring our tongue forward. The hyoglossus allows us to pull the sides of our tongue down. And the styloglossus brings our tongue back and up towards the styloid process, which is its origin point. So all of these muscles work together to help us with articulation. It allows us to have phonemic variation. For example, he versus I. So it's very important for articulation. So how does this cranial nerve 12 hypoglossal help us with swallowing? It's a big help, especially in the oral and pharyngeal phase. So for the oral phase, the tongue manipulates the bolus, and then it puts the bolus in the center where that crest is. It pulls that tongue tip up, touching the alveolar ridge, and it flattens against the hard palate, and then it pushes the bolus from the front to the back of the mouth while dropping the posterior area of the tongue, making room in the oral cavity. So that's the oral phase. And once it hits that fascial arches, then it becomes the pharyngeal phase. That bolus continues and it starts going into the oral pharynx. And as that happens, the pharyngeal wall comes forward. The base of the tongue approximates that pharyngeal wall. The villi palatini closes off the nasopharynx, and then it creates this positive pressure that sucks that bolus towards the esophagus. At the same time, a tongue muscle pulls that larynx up and forward, and then allowing the epiglottis to close and protect the airway, so that way we do not aspirate food. Super important for swallowing. So what about impairments? Okay, so it depends on where the lesion is. If there's a lesion between the brain and right before the anterior horn of the spinal cord, that is called an upper motor neuron impairment. If it is the anterior horn and of the spinal cord and below, that is a lower motor neuron impairment. So it's important to note that a person can have a bilateral, which means occurring on both sides, impairment, or a unilateral, which means occurring on one side. So for a UMN, a person's tongue will experience spasticity and it will be tense. This will create imprecise speech and slow down the speech due to the restriction of your tongue. So for lower motor neuron impairments, the tongue will experience flaccidity. You might lose that crest in the center. It will twitch. It's going to be weak and develop atrophy. So for unilateral lesions on the LMN, you're going to have a problem elevating your tongue tip, and your tongue's going to be, it's going to be hard for your tongue to go side to side. Also, it's important to note that if you have a unilateral lesion, the tongue is always going to deviate to the weaker side. And that same side is where the lesion has occurred. So for a bilateral LMN impairment, it's going to be more severe. You're going to have a harder time elevating that tongue tip. And, your tongue is actually going to protrude your mouth. It's going to be like this. So that's going to cause your speech to be slowed It's going to cause it to sound monotone. It's going to sound slurred, and your speech is going to be imprecise. So regardless of the lesion, your swallowing capability is going to be affected. It's going to be impaired because you're not going to be able to move your tongue around to manipulate that bolus. Additionally, you're not going to be able to pull up that larynx up and forward like before. So that's going to cause an impairment in swallowing, which could lead to varying degrees of dysphagia. So yeah, it's super important. Thank you, and I hope you have a terrific evening. And I tried to make this as quick as possible.